Welcome back to the Racing Mind video series, where we journey deeper into the human mind than anyone has ever gone before. In this video series, we untangle the ancient mystery of mental illness and teach you what you need to know before your racing mind gets the best of you. This groundbreaking series provides answers to some of the deepest mysteries of the human mind and reveals, for the first time in history, the precise cause of mental and emotional illness and the psychophysiological basis of a wide range of psychiatric disorders and associated medical conditions. These educational videos, which present concepts that are so new that they are just beginning to make their way through the medical field, are based on thousands of hours of direct patient analysis and clinical observation in conjunction with the latest research on psychiatric disorders from around the world. In this segment of the series, we will discuss the medical management of neuronal hyperexcitability. As of 2017, more than 80 million Americans were taking psychotropic drugs. That is nearly 25% of the population. Of these, approximately 44 million were taking antidepressant medications, 32 million were taking anti-anxiety medications, 13 million were taking antipsychotic medications, and approximately 10 million were taking ADHD medications. Anticonvulsant medications were not even listed. Yet, as we have been discussing in this video series, there is growing evidence that psychiatric disorders are rooted in neuronal hyperexcitability, an abnormality that is best treated with anticonvulsant drugs. Of course, no one wants to take medication unless it is really necessary, and many people argue that medication has no place in the treatment of psychiatric disorders. Part of the confusion is that psychiatric symptoms such as anxiety and depression are normal emotions, and most persons who experience these emotions are able to work through them and move on with their lives. Hence, they naturally think that others should be able to do the same. The other point of confusion is the failure to recognize that the cognitive emotional system has two components: the mind and the brain. Normally, emotions are generated by mental processes and end in the mind. In other words, they're entirely psychological. In some cases, however, emotions are generated by neurological processes and perpetuated by the brain. What makes this so difficult to understand is that the mind, unlike the brain, is invisible. And so there is a common misconception that thoughts and feelings are merely products of complex brain function. In truth, however, the mind and the brain are as different from each other as a computer and a computer operator. Yet like a computer and a computer operator, they continuously interact. What makes this even more confusing is that mentally derived emotions and neurologically derived emotions are exactly the same, and so there is nothing to tease apart. The only distinguishing feature is the manner in which they are generated. Mentally derived emotions are generated by the mind, whereas neurologically derived emotions are generated by the brain. Unfortunately, however, the biological abnormality that causes the brain to aberrantly stimulate thoughts and feelings is difficult to detect, even with the most advanced neuroimaging techniques. Hence, the underlying neurological abnormality, known as neuronal hyperexcitability, has heretofore gone largely unrecognized. Fortuitously, all of this is about to change with the emerging recognition that neuronal hyperexcitability can be detected via simple heart and respiratory rate measurements. That's right, subtle elevations in heart and respiratory rate, which had previously been interpreted as upper end of normal, are reliable markers of neuronal hyperexcitability. This has profound implications because, as discussed in the 36th video of this series entitled Mental Illness, Tapping into the Root of Chronic Disease, untreated neuronal hyperexcitability can increase one's vulnerability to developing both psychiatric disorders and a wide range of chronic medical conditions such as diabetes, high blood pressure, heart disease, cerebral vascular disease, and cancer. Although the brain is the most complex organ of the body, neuronal hyperexcitability is actually quite simple to understand. As the name implies, the neurons of the brain are simply too excitable. That is to say, they discharge too easily and continue to discharge for too long. This can cause thoughts and feelings to be abnormally intense, abnormally prolonged, and in some cases, contextually inappropriate. The means by which these thoughts and feelings are generated is via the induction of magnetic fields as neurons discharge and recharge. The associated energy fields stimulate thoughts and feelings in much the same way that signals from a radio station do as we listen to a news report or a favorite song. Therefore, the more often they discharge, the more they stimulate the mind. In many cases, this abnormal neurological activity can be seen in the extreme thinking and eccentric behavior that is demonstrated by persons who are affected by this genetic abnormality. The simple treatment for neuronal hyperexcitability is to calm the brain. This can be done through stress reduction, establishment of an early sleep schedule, regular exercise, enjoying a relaxing hobby, avoiding caffeine and other psychostimulants, and minimizing refined sugar. If these interventions are either too difficult to implement or fail to yield satisfactory improvement, then treatment with neuroregulators may be necessary. More commonly known as anticonvulsants, neuroregulators were originally developed to treat seizure disorders. Like psychiatric symptoms, seizures involve neuronal hyperactivity. The difference is that in seizure disorders, large groups of neurons repeatedly fire at the same time, whereas in psychiatric disorders, they fire like popcorn. In both disorders, however, the neurons are overactive. Hence, the same kinds of medicine are effective for both disorders. On the board is a list of neuroregulators that have been found to be the most effective in the treatment of psychiatric disorders. Because of their direct effects, all these drugs are very fast-acting, generally reducing symptoms within 1 hour of achieving the right dose. Another way to quiet the brain medically is to activate its inhibitory mechanisms. This technique, known as electroconvulsive therapy or ECT, is a procedure in which a small current is applied to the head in an effort to induce a seizure. ECT uses the brain's natural response to seizure activity, which is to temporarily resist further stimulation, to reduce the level of excitation in the brain. In most cases, the procedure begins to break the vicious cycle of mutual overstimulation between the mind and the brain that causes psychiatric symptoms to perpetuate. Although ECT does not permanently correct the underlying problem of neuronal hyperexcitability, it can be indispensable in patients who are either unresponsive to medication or unable to tolerate the side effects of medication. Multiple treatments and ongoing maintenance treatments are usually necessary. Newer treatments, such as repetitive transcranial magnetic stimulation, vagus nerve stimulation, low-dose ketamine, and stellate ganglion blocks are also available but are rarely needed when neuroregulators are taken properly. Control your brain, control your life. We hope that you are benefiting from this video series. Portions of this video and others in the series were taken from the books The Racing Mind and Am I Depressed or Am I Bipolar? Those interested in developing a deeper understanding of this topic can also refer to the scientific publication, The Multi-Circuit Neuronal Hyperexcitability Hypothesis of Psychiatric Disorders. Please note that these materials in this video series are for educational purposes only and are not intended to guide treatment without formal evaluation. This video series is sponsored by the Binder Foundation, a charitable organization that is dedicated to the enhancement of human life through research and education on disorders of the mind, body, and spirit. If you have found this video to be a benefit to you, please share it with your family and friends. And please don't forget, your feedback is important to us.